Hello, everybody, and thank you for joining us a few minutes later than advertised so that people could join the national clap for Captain Sir Tom Moore and the nation's health workers. My name's Tom Rutland, and I'm the treasurer of LGBT Labour, and I'll be chairing this evening's discussion that's kicking off our series of events for LGBT History Month. It's HIV testing week, so we're delighted to be hosting tonight's event in partnership with the Terrence Higgins Trust, where we'll be discussing how Labour can make the HIV Commission's aim to end new HIV transmissions by 2030 a reality. I'll introduce our brilliant panel shortly, who you can see in front of you, but first we're going to hear from one of the HIV commissioners, Wes Streeting. Wes is a long-time friend and now patron of LGBT Labour, the current Shadow Schools Minister and a former head of education at Stonewall. So Wes, over to you.
Thank you, Tom, and thank you everyone for joining us this evening for what is a very timely event, coming as it does at the start of LGBT History Month and the middle of HIV testing week. So I couldn't be more proud to open tonight's event by sharing some of my experiences as a member of the HIV Commission. I'm sure, like me, you've seen all sorts of commissions come and go over the years, often with very little impact. This one is different, and if politicians follow through on their promises, it will be both history-making and life-changing. Led by Dame Inga Beale with the support of the Terrence Higgins Trust, the National AIDS Trust and the Elton John AIDS Foundation, we had a simple mission: to find ambitious and achievable ways to end new HIV transmissions and HIV-attributed deaths in England by 2030. On World AIDS Day, we launched the report of the HIV Commission after more than a year of thorough research, consultation, and engagement with experts, service leads, and people living with HIV right across the country. And I know, not just because Ian's on the panel, but looking at the audience, some of the amazing people that were part of that commission process. And I'm thinking particularly now about the staff of the three organisations. Louise, who was our secretariat, are here, and they did just an absolutely fantastic job making sure that that process was a genuine consultation and that we were drawing on the huge amount of expertise that is out there in the country. As a result of that hard work and enormous goodwill from such a wide range of organisations across the country and people living with HIV themselves, we were able to set out exactly what needs to be done through 20 practical recommendations to achieve that 2030 goal, including making testing routine by introducing opt-out testing right across healthcare settings. People shouldn't be going to sign on with a new GP, for example, or going for tests for other blood tests or other tests for a range of conditions without having an HIV test at the same time. After almost a year of this miserable pandemic, we are used to the importance of test, or at least should be if the government got its test and trace system sorted out. Well, in this case, test is really, really important if we're to achieve that goal. We also called on the government to set a new ambitious target to reduce new HIV infections by 80% by 2025. We know that getting to the last 20%, the last 1 in 5, is going to be the hardest job. And we've got no chance of achieving it really unless we've broken the back of the progress we need to make by halfway through this decade. So a reduction of 80% of new HIV infections by 2025 is really important. And after a decade of cuts, particularly cuts that have affected public health budgets for local authorities across the UK, we think it's important that there's now a radical uplift in public health funding to improve sexual health services and treatment as prevention. We also need to treat every late diagnosis of HIV as a serious incident so that we can properly review and understand the reasons for late diagnosis and put in place measures to prevent HIV-related deaths. And equally, importantly, perhaps most important of all, we need strong leadership at a local and national level with annual accountability to Parliament for action against the plan, something I felt really strongly about, having both been a member of commissions and working groups in the past, also lobbying commissions in the past. seeing a worthy report published and then gathering dust on the shelf. We're determined this is not going to be one of those plans. We don't have time to waste, as Keir Starmer said at the launch of our report. So it's really important we're holding government to account each and every year in Parliament. As I mentioned, Keir, I was really proud actually to see Keir Starmer speak at the launch, and of the personal commitment he's shown to the cause, because that political leadership is going to be really important. And I'm not just saying this because Alex is on the panel this evening, but throughout this process, the support we've had from both John Ashworth and Alex Norris as the Shadow Public Health Minister has been absolutely superb. What I didn't anticipate, if I'm honest, is that the government would commit on the day of our launch to accept the 2025 target immediately, and also to using our report as the basis for the government's own action plan to be published later this year. And for that, I applaud the government, and Matt Hancock deserves genuine credit for turning up in the House of Commons, given everything else that's going on, to make those commitments on the record in Parliament. Sometimes it feels like the stars align around a particular cause or campaign and everything falls into place as if by magic. It certainly felt like that on World AIDS Day, and it's felt like that again with the broadcast of It's a Sin, the profound and seminal new series from Russell T Davies, which portrays the early days of the AIDS pandemic in the 1980s. But I think we all know that that's not how campaigns work. Real change, lasting change, doesn't happen by accident or by chance. It happens because people fight for it. Our community has been at the forefront of this fight since it was first dubbed the gay plague. The generation that lived through that period, and too often died throughout that period, were fighting stigma and prejudice at the same time they were fighting a deadly virus. It's entirely thanks to their courage, the support of allies, and the hard work of those that have followed that we have reached a point where people living with HIV can lead a normal, happy life, and where we can not only imagine a future for our country, where no one living with HIV dies of HIV causes and no one receives the terrible shock of an HIV diagnosis, we can actually plan for, and indeed have a plan to make that future a reality within a decade. Success in tackling HIV within the LGBT plus community has seen a fall of 47% in new cases of HIV since 2014, and thousands of gay and bisexual men can now access the anti-HIV drug PrEP thanks to tireless campaigning. But let's not forget, not only did the government shamefully delay its implementation, it only acquiesced when the National AIDS Trust took them to court. And we know that as a consequence of that delay, there are people who have been diagnosed with HIV who would not have been had the government acted when it was demanded and when it was necessary to do so. And while treatment has improved and treatment now means prevention of transmission, stigma and prejudice have not gone away. In our communities, in our workplaces, and even in our National Health Service, we still see stigma and prejudice too evident. So to that extent, It's a Sin hasn't just offered a window into our past, it's held up a mirror, an uncomfortable mirror to modern Britain. And for me, one of the most shocking parts of our inquiry was that the experiences of trans people that we heard were just completely shocking. Even knowing what we know about the disproportionate hate crime, discrimination, violence, death that trans people experience, I still don't think we as a commission were quite prepared for what we heard. This issue doesn't get nearly enough attention or coverage, so I'm going to focus my remaining remarks about what we know and what needs to be done in respect of the experience of trans people and HIV. During our year-long inquiry, the HIV Commission found a serious lack of access to informed health services in the UK for trans people, with many health professionals lacking basic understanding of how to provide care and support. Often this stops trans and non-binary people accessing sexual health services altogether due to misgendering, prejudice, and being given incorrect information for their bodies. A survey by Terrence Higgins Trust reveals that more than half of trans, non-binary and gender diverse people struggled with their sex life, and 45% had never tested for HIV. This comes despite trans people being at increased risk of HIV, with several studies showing particular subgroups of trans people, including young, ethnic minority, trans women, BAME people, migrants and sex workers being more likely to have HIV touch their lives. National HIV Testing Week is the start of our collective efforts to address this, but much more needs to be done if we're going to get people effectively tested for HIV and preventing HIV diagnoses which are entirely avoidable. Despite this clear evidence, it took until 2015 for new HIV diagnoses amongst trans people to finally be recorded correctly. However, we know there remain real inconsistencies in how this data is collected across the board. And this is damaging in two respects. It erodes the visibility of trans people within our healthcare system, and it hinders our ability to reduce new cases of HIV within this population by fully understanding what's happening. Even when it comes to providing basic information about HIV, trans experiences are often missing. That's why empowering these voices through supporting trans-led organisations to engage with trans people and to make sure that they are speaking for trans people is so important. The rollout of PrEP is a shining example of this. Without a service like Clinic Q, which provides sexual health support for trans people living in South London, uptake of the PrEP impact trial for trans people would have been far lower. These services are often far better placed to know what trans people need more than a national general service ever could, but they need the funding to do it. At the core of many of the issues trans people told us about was the long-standing and systematic disempowerment of trans people and trans communities. The discrimination trans people face when accessing support around HIV is twofold: transphobia on one hand and the wider problems of HIV stigma on the other. These barriers can have a huge impact on both the physical and mental health of trans communities. Even in the places that do offer vital tailored health and wellbeing support for trans people, transphobia and prejudice from some corners of our society is stopping them from doing their job. I'm deeply worried about the precedent that the Tavistock versus Bell ruling could set in the ability of young trans people to be able to access things like the contraceptive pill and wider information about sexual health. I fully support the challenge made by organisations including Stonewall Brook and Gendered Intelligence. The right of young trans people to access the healthcare they need to be healthy and happy must be upheld. And look, we know in relation to trans rights and trans people's lived experiences that issues are up for debate when we often feel very strongly they shouldn't be. But we also know, those of us who are lesbian, gay or bisexual, that this has always been the case when it comes to LGBT plus rights and inclusion. And so it's our responsibility to step up to the mark, not just the responsibility of trans people, but the responsibility of allies too, to make sure that where these issues are up for debate and where there are arguments to be won, that we are there making the arguments. It means we need to give less airtime to those spouting ill-informed views, whether through the columnists of Sunday newspapers or the Twitter feeds of MPs, including, sadly, sometimes Labour MPs. Because again, when it comes to gay rights and LGBT equality, the Labour Party hasn't always been on the right page at the right time. Not everyone in the Labour Party has always been on the right page at the right time. But by building a strong coalition of support, by building well-evidenced and well-made arguments, we can always win the debate, whether within our party or within our country. It's how the Labour Party has always managed to be, despite the challenges and the pitfalls and the hurdles along the way, the party for equality that has advanced LGBT equality every single time it has been in government, positively shifting the needle in the right direction. So that's the challenge that we should be reflecting on tonight. The challenge of making sure that the future for LGBT plus people in this country is a bright one. The challenge of making sure that for people living with HIV, they can live free from prejudice and discrimination and live long and happy lives. And also work towards the goal that we have within touching distance, the transformational impact we can have by ending HIV-related deaths in our country and ending new HIV infections in our country within a decade, being the first country in the world to do so. That's the exciting prospect that the HIV Commission has created, and it's up to all of us to work together to beat a path to that bright future.
Brilliant. Well, thank you, Wes, for that uplifting overview of the Commission's potentially life-changing work and recommendations, and for giving us a lot of food for thought as we begin our discussion, particularly around the continuing stigma and the prejudice that trans people face in accessing health services. As you say, the government's accepted the recommendations, so it's going to fall to us, the Labour Party, to hold their feet to the fire and ensure that we get there. So tonight, joining us, we have Alex Norris, Labour's Shadow Public Health Minister and Member of Parliament for Nottingham North, Councillor Steve Hughes, who lives with HIV, a councillor and cabinet member in Rossendale Borough Council and the CEO of the Citizens Advice Service that covers Stockport, Oldham, Rochdale and Trafford. Florence Eshalomi, the Labour MP for Vauxhall here in glorious Lambeth and a former London Assembly member. And rounding off the panel is, of course, Ian Green, the Chief Executive of the Terrence Higgins Trust. So we'll be taking your questions after the panellists have spoken. So please send them to me in the chat box and we'll get through as many as we can. And after the questions, our patron, Stephen Doughty, will give some closing remarks. So Alex, as the responsible Shadow Minister, why don't you kick off the contributions from our panellists?
Thank you, Tom, and thank you for having me. It's a pleasure to follow Wes and your kind introduction. As you say, I'm Alex Norris. I'm Labour and Cooperative Member of Parliament for Nottingham North, and I have the pleasure of being Labour's Shadow Public Health Minister. I was reflecting as Wes was talking, certainly when he talked about It's a Sin, which has been such a seminal moment, I think, in Britain's understanding and coming to terms with our history of HIV and AIDS in our country, that how freely and easily we assemble today. You know, we've got extraordinary barriers between us because of this pandemic, and I hope people are managing that as best they can. But we come together to talk about this issue free of fear, well, certainly relatively free of fear and stigma, whereas those characters, but actually reflecting real lives, met with stigma, ignorance, hatred at every corner, you know, and weren't able to assemble as we are. But I think tribute to LGBT plus Labour, because actually for 46 years you have been providing safe spaces for those conversations and for that solidarity, and similarly for Terrence Higgins for a similar amount of time. So when it was really hard, you were there with people, giving people that space. And you know, we should never take it for granted, the legacy in which we build on. I'm here, Tom, tonight to reiterate the Shadow Health team's full bore commitment to eliminating transmission by 2030. We're delighted that the government are in that space too. We're delighted that they want to build on the Commission's recommendations. We called on them to do that, and we will support them to do that. And we will, as you say, we will hold them to account in Parliament every step of the way, because the elimination of transmission, I believe, and we believe, is a foundational public health project in our post-COVID settlement. You know, COVID has shone a light on the gaps in our public health in this country, on our inequalities. And as we rebuild after COVID, we have to focus on those projects that will close those gaps. And this, as I say, is one of those foundational ones. I want to say a few things about how we want to do that. I mean, the temptation actually is just to say, we'll do what the Commission said, because broadly, that's what I'm going to say. You know, I'm glad the government are roughly in that space, but quite what that means, there'll still be a bit of work yet, because I think there are some very challenging things to read in the Commission's recommendations, certainly about the nature of public health services in Britain at the moment, that we hope that they can do much better on. But for me, I've boiled it down to 5 things which are reflected in what Wes has said, which I don't think will surprise you. But firstly, test. You know, that's been our lesson of this year, and that doesn't change just because the issue has changed. So moving to opt-out testing in the NHS, genuinely making every contact count. You know, removing the stigma from having that test and just making it just as normal as any other testing, we think is a great way to close that net in. Secondly, PrEP in all parts of the health service. That has been a battle, as Wes said. We now need to move that from an issue about the principle of PrEP to now it's an issue of health equity. That it can't be a cities thing, it can't be just an HIV clinics thing. It has to be available wherever you access your services. That's where you can access it. And that actually is, as a political point, if you don't mind me briefly doing, Tom, that's part of Labour's comeback too. That, you know, our comeback involves, of course, towns. We talk about towns a lot more, but also rural communities too. So things like PrEP will become a real health equity issue, are a health equity issue. And we've got a responsibility to talk up for those communities and make it just as normal as any other basic healthcare provision. Action on late diagnosis, and I think the point Wes made about treating every late transmission as a serious and individual incident. Of course, that brings us back to contact tracing, as we talk about a lot at the moment, but the learning from every late case of late diagnosis, because what did that tell us about how we contacted as statutory services or voluntary services with that individual? Not rather than putting the blame onto the individual, what were the environmental and social factors that caused that late diagnosis, and what can we do to change that in the future? Fourthly, crucially, because we mustn't think of this as bank progress, it's massive, wide-scale anti-stigma campaigning. Now, you know, things like It's a Sin do an extraordinary job of that, of bringing, frankly, gay sex into the mainstream and the norm, and seeing that reflected on our screens in the way that we take it for granted in heterosexual sex. I think it's a really powerful scene. I know for myself, in my formative years, I grew up in Manchester, born in the 80s, kind of teenager in the 90s. And Queer as Folk had a really profound impact on me and my friends, because it took homosexuality from something that might be a bit exotic or different or strange, as seen in TV or maybe read tangentially about in the newspapers, to something we realized 3 or 4 miles away that our city was a beacon and a center and a haven of. And that, again, changed our perceptions massively. So again, we hope to see, I'm sure we will see that with It's a Sin, but we have a responsibility to go further than that and to take leadership roles. You know, who better, actually, as people often say, you know, politicians, perhaps we're not the best advocates for certain causes. Who better than us? We go to every doorstep, we have difficult conversations, and, you know, a massive, wide-ranging anti-stigma campaign, I think, would be an important part of where we go next. And then finally, though, we can't talk about this enough, proper mental health services that understand, you know, we talk about parity of esteem, we talk about parity of esteem in this country over and over again, but actually we're so good at trying to treat whatever the physical symptoms are, and we don't close the loop on the perhaps longer scars that stay with people mentally. We have to do much better than that as a country. We're going to have an awful lot to do post-COVID on this, but more broadly also. And then finally, I've done my 5 already, but I missed this on my notes as I went through. This is local government conference week, so I wouldn't get out alive of this Zoom without recognizing the impact on local authority public health services over the last 7 and 8 years of year after year cuts. You know, I say this as a position, as a sinner for these first 3 of those in Nottingham. I was our public health lead, and we've had to nibble away at the public health budget. Every budget in local government has been nibbled away at. So what you see now is a very distressed public health budget that's seen year-on-year cuts. And then actually, when you absorb the growing demand in your demand-led services, certainly around drugs and alcohol, there isn't an awful lot else left. So it's pushed what should be vital testing, should be vital awareness campaigns, rather than being of the very many feelings, the sadness, the happiness, the anger, the tears, whatever feelings. I think everybody had the common strain of looking at Jill and thinking, God, I wish I had a friend like Jill. And of course you would, as well as being someone who would be there in your darkest moments, know what you're thinking, empathetic, cool as anything too, great fun. But actually, what these circumstances require from as many of us as possible is not for us to have friends like Jill, but to be friends like Jill. And I think what Wes said around trans rights particularly, that is a call for us to do that. That is our civil rights fight in this generation. So that is our call to action, to do that, to be there, just in the way that we've seen others, and we will rightly laud what others have done in previous decades. This is our decade for that, and we must meet that moment too. So can't wait to do it, to get to the fight today, tomorrow, Tom, but also in government too. And I'm very grateful for the chance to be here today.
Brilliant. Well, thank you for that, Alex. It's always really important to get the front bench perspective. And I know that our members will be really pleased to hear that you're prioritising this issue in the public health brief. And the points you made, particularly on public health and local government cuts, are absolutely spot on. And we've got to see an increase in funding there. So who better to hear from next than Councillor Steve Hughes?
Thanks, Tom. And yeah, I don't know how to follow that, but for everybody that doesn't know me, I am Steve Hughes. I am the CEO, as Tom said, of Citizens Advice Service in Greater Manchester. And I'm also a councillor and cabinet member on Rossendale Borough Council. For those that don't know where Rossendale is, it's a small little valley at the top of sort of Greater Manchester. I call it the gateway into Lancashire. Lovely little place, worth a visit if you've not been. And I was first elected onto that council when I was 19, so quite young when I was there. But since December 2016, I have been living with HIV. My status in the main stayed a secret for nearly 4 years, I think. And I actually only told my mum that I was HIV positive a year ago. And I've not got long, but I just want to talk quickly about some of the things that stick in my mind when that diagnosis happened. And I will never forget how I felt actually when I was told that I got HIV. Ashamed, dirty, scared. They were the sort of key things that I felt, and actually do look back at that and still sometimes feel like that sometimes. But actually, as part of that, there's two other things that I absolutely remember. The first one is what my consultant said when I was diagnosed, and when he gave me that diagnosis. He said, Stephen, I could have given you a diagnosis of diabetes today, or even worse, a cancer diagnosis, but I haven't. I've instead given you a diagnosis of HIV. And let me tell you now, it's something that will absolutely have very little impact on your life. Now, at the time, I absolutely didn't believe him. The second one was actually when I got home, one of my closest friend and housemate, he said, well, he actually gave me a hug, which was a very unusual thing for him to do. And he said, you'll be absolutely fine. And you know what? Both of them were right. And I didn't believe them at the time. There was absolutely I wasn't in that headspace. But they were absolutely right. I live a great life. I have a fantastically supportive family. I have a great and loving partner. I have a great group of friends. I take one pill every day with absolutely no side effects. And by taking that medication, I actually know 100% confident that I will not pass HIV on. But not everybody knows that. Not everybody wants to know that. And that's one of the reasons why I'm particularly committed to telling my story and being open about my status. It's really important that people do know that we can't pass on HIV if you're on medication. We absolutely need to challenge that stigma and discrimination, something that I actually have been victim of myself. It's a sin, and a couple of people have already spoken about it. It's a massive thing at the moment. It's a sin that has sparked an immense conversation about HIV on a level that I've never seen in my lifetime before. And we absolutely need to make the most of that. And we absolutely need to make the most of it by normalising HIV testing and a normalising conversation about HIV and helping to eradicate that stigma and discrimination that people like me, unfortunately, do face on a regular basis. I'll leave it there. I am really, really excited about the conversation that we're about to have, the debate that we're going to have. So yeah, thanks very much, Tom.
No, well, thank you, Steve, for sharing your sort of moving experiences with us. And I was particularly interested to hear about how long it was before you felt you could talk about your HIV status. And it almost sounded like being back in the closet, I imagine. So we only really want to experience that once in our lives. So it's really important that we do tackle that stigma and discrimination. It was good also to hear how positive your doctor was about it. So now let's hear from Florence.
Thank you very much, and so great to be with so many esteemed colleagues on this call, and just thinking how I'm going to follow just inspirational words there from Steve around his own personal experience, which I think when we're talking about an issue like HIV, that's the most powerful thing. Hearing from people with that lived experience can help break down some of those barriers, which we know unfortunately still exists in 2021. When Terrence Higgins Trust contacted me to say and LGBT Labour contacted me to say would I be on the panel, absolutely delighted to be on the panel, because for me as the MP representing Vauxhall, representing such a diverse and vibrant community, a constituency in the heart of South London, but equally representing one of the constituencies with the highest LGBT community. And on the flip side of that, a diverse community where I know that unfortunately a number of my constituents are suffering from HIV. That's something where I think, you know, it's incumbent on me as the MB to make sure I use my platform to talk about that and making sure we get the support for people like my constituents. And one of the statistics that struck with me was the figures from the All-Party Parliamentary Group on HIV and AIDS, which highlighted that data from 2019 showed that 4,139 people were diagnosed with HIV in 2019. And of the 1,559 heterosexual people diagnosed in 2019, 37% were Black African men and women. And I think there's a number of key issues that we need to look at in terms of understanding why there is a case of a high rate within some of our BME communities. And to start with, I think we need to address some of the things that both Steve, Alex, and Wes talked about around the lack of awareness on services available. For a number of people from certain communities, they're not aware about how to access general knowledge of the NHS. We all, you know, immensely proud of our NHS, our greatest public service, but yet a number of people don't know how to access the NHS services. And we also have to be honest about some of the structural barriers from people from certain backgrounds, including people who may not have their immigration status sorted out. And the whole area contained around the hostile environment where people think that actually they have to pay for some services. And we know that the Tories have unfortunately implemented upfront NHS charges. And when you're on a low income, when you're on an insecure 0-hour contract, the last thing you want to do is pay to go and have a test because you're thinking it's going to cost you, because you're worried about, you know, how you can get to work. You're worried about your heating bills. You're worried about feeding yourself. Then if you've then got children, you're worried about how do you care for them. We also need to look at the language barriers. For a number of people from BME communities, English isn't their first language. Again, we've seen cuts in translation services in a number of our hospitals and GP surgeries. And I think another thing which has been borne out during this pandemic is around patient confidentiality. For a number of people from certain communities, they still feel that doctors and nurses, people in trusted positions, may talk to their family members, maybe talking to other people within their community, and they don't want to then go forward and talk about the fact that they may be HIV positive, even though we know that obviously patient confidentiality is at the top in our NHS. I think another area that I think we need to address is around the comprehensive relationship and sexual education. For many Black Africans and other BME communities, there's still a taboo about talking about sex, let alone talking about HIV. And I think, you know, looking at I'm so proud to see, you know, Wes in his role as Shadows Education Team, someone who I think we have the big role as a Labour Party to make sure we push for an inclusive education policy, talk to all children. And this is something that we have to look at rolling out across our schools. We have to be honest to the fact that a number of children now in 2021 are accessing pornographic images, videos, exploiting other young people. And so it's so important that these young people are learning about healthy, safe relationships in a safe environment from their teachers and from educated professionals, and maybe in a youth club setting, instead of them getting the wrong information about what a good relationship is or isn't. And I think the last issue that I want to focus on because of time is about how we address the issue of this and discuss the issue of LGBT plus within the BME communities. We still know that as we are sitting here today, there are still so many countries around the world where it's illegal for you to be in an LGBT relationship. We need to talk about that. The discrimination, the ignorance, that's for some from those communities as well, that you only catch HIV if you are a gay man. We have to be honest and say, actually, not feeding into those stereotypes and remind people that anybody can catch HIV and that there's a range of fantastic services and charities, including Terrence Higgins Trust, to help you deal with that, as Steve has highlighted tonight. So it's incumbent on all of us within the Labour movement to continue to talk about the fact that this is an issue for all of us, regardless of your background, your age, your race, your sex. We are all committed to this one goal of ending HIV transmissions and helping people who have HIV to access the best care. Thank you.
Well, thank you, Florence. And it was really helpful to hear about HIV in BAME communities and the barriers that people face in accessing healthcare services. And of course, it's fantastic to have you as such an ally advocating for proper inclusive sex and relationship education for all children in our schools. So finally, Ian, what needs to happen to make the Commission's aim a reality?
Well, first of all, thank you very much for arranging this event in partnership with Terrence Higgins Trust. It's really important to us that, as a non-party political organisation, that we engage across political parties, because for us it's about the cause and the issue, and we need to make sure that we're communicating effectively with a wide variety of different stakeholders. And I'm so pleased with the really good relationship we've got with Alex and the rest of the front bench team, and very grateful to him that he's accessible to me when I need him. So thank you very much for that, Alex. Who would have thought that less than 40 years following the death of Terry Higgins, we could be even dreaming about ending new HIV transmissions in the UK? Less than 40 years. It's something that we may have thought was a dream, but what the HIV Commission has really indicated is absolutely it's achievable. It's ambitious, but we have all of the tools in the toolbox to make that happen. What we then now need to do is to make sure how they're utilised in the most effective way, in order to make sure that we have very clearly that goal within our sight. I'm conscious in terms of my own journey with HIV that I was diagnosed with HIV in 1996, and so for almost 25 years I've lived with the virus, and what Steve was saying really resonated with me. My consultant wasn't able to be as optimistic when I had my diagnosis, and I was told at that time I might have between 8 and 10 years left to live. Medical advances now mean that I can have a normal life expectancy, and my HIV negative husband, it's impossible for me to transmit the virus to him. And It's a Sin has really framed a narrative around HIV, which is so important. But as Florence has indicated, we need to make sure that people understand what HIV is today, and it doesn't just affect gay men. In fact, that I think over 40% of people living with HIV are women or heterosexual men, a lot of them from the Black African community. And so our messaging needs to resonate with a wide variety of different groups to make sure it's relevant, and that we are speaking with credibility in terms of our messaging and doing that positively. So the Commission was a really important, that was established by 3 charities and funded by those charities. We had no government funding, no pharmaceutical funding for that. It all came from our charitable resources, because we felt it was so important that we gathered a group of individuals together to really examine what needs to be done. And Wes has given us a really good summary of the key recommendations. But what can we all do then to take the HIV Commission's recommendations forward? Well, my first thing to say is we need to make sure that we are aligned to the ambition. We need to be really clear that absolutely this is something that we can do, and set ourselves very clear targets along the way. The government has committed, as we've heard already, to publish a HIV action plan later this year. We can't let that slip. We really must not let that slip. We have to ensure that the government has the commitment and the resource available to deliver a really comprehensive action plan despite COVID. And I think that often that we're told that issues are being pushed to the grass because of COVID. This pandemic, this earlier pandemic, is one that can't be ignored. And so that's the first thing that we need to do. We also though need to make sure there's really strong leadership and accountability. That we are seeing clear leadership currently coming from the government, and also really good leadership from the Labour Party and other political parties as well. But we can't, as the charitable sector, just assume that leadership and that commitment's going to stay in place forever. And so this is where we as the charitable sector need to also hold feet to fire. And trust me, we will do that with our colleagues at the National AIDS Trust and with the Elton John AIDS Foundation, to everybody demonstrating leadership, both at a local and a national level. Because it's a shared responsibility. It's not just a responsibility of the government in power today, but it's a shared responsibility of all of civil society and society to achieve that ambitious goal of ending new HIV transmissions. It's going to cost money, absolutely, and the Commission's not shied away from that in its recommendations. We've heard about the devastating cuts we've seen to public health funding. Alex mentioned it was nibbling at the public health funding. I think in some places it's gnawed at public health funding in very different parts of the country. And you know, I completely understand the challenges that local authority councillors have in trying to balance the real challenge of making sure they've got the funding to deliver statutory services as well as to deliver to these ambitions. And I really do feel for them when funding has been reduced so significantly. So there needs to be a significant uplift in public health funding, and some of that needs to be very clearly allocated to HIV prevention and support. We're not going to get to the position of getting to zero HIV transmissions unless simultaneously we're tackling stigma. Much has changed in HIV, but the stigma associated with HIV is something that's very real and is a real barrier as well to people getting tested for HIV. And in National HIV Testing Week, it's really important that we don't shy away from saying there is too much stigma and discrimination being faced by people with HIV, and we do need to make sure that that is addressed and addressed robustly. How individuals on this call can get involved, I think it's really important that, well, because you're here, it really shows that you have a commitment. And I'm sure that many of you have a personal commitment because of perhaps lived experience of HIV as well. But what I think is so important is that in the recommendations from the Commission, the importance of local action and local action plans is identified. So I'm delighted to see there's some local authority councillors on the call. Please do go back to your local authority to start to have a conversation about the HIV Commission's recommendations. We've engaged with a number of local authority leaders, all of whom have been incredibly supportive about the Commission and its findings. But that needs to now be placed in a context where action can be taken to make that a reality in local communities. And we and our colleagues at the National AIDS Trust will be delighted to make sure that we can provide you with support in addressing local action plans in your local community. People often ask me what motivates me in my role as Chief Executive of Terrence Higgins Trust. I think two things that I would just want to conclude on. One is that goal, that prize of ending new HIV transmissions in the UK. That's absolutely something that we can do. But the second is more personal, and it goes back to my own diagnosis. I don't want any other 31-year-old to be told they have HIV. We can all do this to achieve that ambition and to make sure that's a reality. So thank you very much for being here and for listening to me and allowing me into this space to talk about my passion.
Well, thank you so much, Ian, and thank you for all of the work that the Terrence Higgins Trust has done to support people living with HIV and to end transmission. Of course, for our audience, it is HIV Testing Week, so you can get yourself a free HIV self-test kit from the Terrence Higgins Trust if you go to their It Starts With Me website, which is startswithme.org.uk, and play your part in knowing your status and ending transmission. So thank you to all of the panelists for that. We're now going to take questions, and we've had lots in already, so I won't necessarily come to everybody for all of the questions, and we'll probably group them together and we'll get through as many as we can. So I think the first one that would be worth asking is that testing came up in the Commission's report sort of again and again as absolutely crucial. We're talking about it now as part of Testing Week. So how do we spread HIV testing throughout the healthcare network? How do we get it into GPs and into pharmacies? I might go to Ian first and then to Alex on this one.
Yeah, so it's a really good question. It's a lot of that is about normalising HIV testing and making sure that the healthcare pathways also are aligned. We've got a really complicated healthcare system and structure in England in particular. And we just need to make sure that the structures aren't blocks to facilitate and enable testing. And so I think this is where leadership is required. So we do need to make sure that that the Secretary of State and others are making sure there's no blocks in the way through Hughes providing the funding for a particular testing service. But we also need to do is to make sure as well that the opt-out approach to testing is something that is just there. I mean, we've seen it effective in maternity services, where every pregnant mum is provided with a HIV test. People can opt out, very few people do opt out. And because of that, we virtually eliminated mother to baby transmission of HIV in this country. So it works. It's about making sure that we give the system the ability to make it happen on the ground, because there are so many missed opportunities to test for HIV, and that's what leads to late diagnosis and poorer health outcomes for those who are diagnosed late.
You come to me next, Tom. I mean, I'd obviously say I completely agree with everything that Ian says there. It's that idea of making every contact count, making it the norm, and an opt-out basis is, I think, the way to maximise, with our incredible developed health services we have in this country, and all those ways in which they impact on people's lives. That is a massive way to try to create that safety net. But also then beyond that, and this is very much harks to what Wes said around the getting the first 80% done in these first 5 years, because the last 1 in 5 is going to be really hard. Then it's being very very targeted around your data, understanding as Florence said, which communities are areas in which we're not seeing the same level of progress, whether that's for cultural reasons, whatever the reasons are there, and how do you do it? If you can't change the message, how do you change the messenger? And all those sorts of things to be very targeted. And again, back to local authority public health is a perfect example about there, being very clear about where that patchwork is emerging and where you might need to what you might need to develop differently. And again, having, as I said at the beginning, a real rich sense of your city versus town versus rural, and how things are developing over the years at different paces around perceptions and behaviours, and again, being very targeted around that.
Brilliant, thank you both. So the next question, a couple of questions. One is about how do we reach communities beyond the obvious gay, bisexual men who have sex with men? And another linked question that's come in is, has the HIV Commission identified specific barriers to accessing testing and prevention programs for BAME people? And what differences in approach and extra efforts does the panel think will be required to make sure that BAME people are not left behind? So Florence, would you like to kick off?
I think on the second question that you highlighted, and it's almost coincidental that we're now seeing it with the coronavirus and the vaccination rollout, where if all of you who've been following the news, you'll see that there's it's called vaccine hesitancy with a number of people within the Black African Caribbean communities. And this comes back to some of the distrust around medicine and the medical profession. And we know that there was a time when there was some of the testing on vaccinations carried out in some African countries, and people may have that distrust of vaccinations and the hospital. But it's about how we educate people around the fact that actually by being involved, accessing those services, you will increase and improve your quality of life and your access to medicine. And it's about especially talking about, young children get vaccinated throughout their lives. When you have an elderly relative who's in hospital, the same medication that they're using, it's the same doctors and scientists that created that. So breaking down some of those barriers and fears, and consistently making sure we're providing accurate information. If I told you that some of the misinformation I've been shared on WhatsApp around the vaccination, it's just so worrying, and people are believing that. So it's the same around people coming forward to get tested for HIV and to know that actually they're not going to die, and it's just, as Steve said, just one pill. So it's really important. And I think lastly, the other thing is around where we're getting people from certain communities to access that care and advice. It has to go beyond the setting of a hospital setting. For some people, that clinical feel just feels alien, feels scared, and it brings fear into you. My late mother suffered from a disease called sickle cell anemia. She was in and out of hospital. But I kid you not, every time I went into the hospital, I was always scared because there's that hospital smell. I'm sure you all know it, right? And it's about making sure, you know, we look at accessing those services within the community. That would help bring people at ease and bring people forward to talk about, you know, some of the issues they're going through, and making sure they're honest and able to have a conversation about, you know, I should get tested. This is something that's on my mind. So it's a slow process, but actually local government has a massive role to play in this because they are embedded in their local communities.
I suppose the other thing to add to that, I absolutely agree with everything that Florence has said. I think the other thing to add to this is actually there's something about education within schools for me. I remember it wasn't that long ago when I was at school, and I don't really remember having a proper conversation about sex education. So regular STI checkups, you know, what is chlamydia, what is gonorrhea, all that sort of stuff. They're not easy and comfortable conversations to have, but absolutely really important. And I just think there's something about at a young age being open about what sex is, what gay sex is, what straight sex is, all that sort of stuff. And I think as part of that conversation, actually they need to have regular checkups, not just for HIV, but for other STIs as well. And I think that conversation will help it become normal within our everyday lives. Because I remember going on the dating scene and having regular checkups. I was always quite good at it, but I had friends that were not. Some people I know have never had a sexual health test, and it's quite scary on a level that it's not normal as part of our sort of as part of our normal life. And I just think there's something about that for me that is really, really important.
Absolutely. So the next question is, well, there's two questions. One is sort of what's next, you know, in the event that we get there and we end new transmissions by 2030, what's the next target, Ian, if you can look so far ahead? And then the other question that's sort of related on the what's next front is, what is THT and what is Labour doing to sort this internationally?
So just in terms of what's beyond 2030, I mean, I've not looked that far ahead currently. However, what a challenge to have as an organisation to decide what comes beyond ending new HIV transmissions. I mean, unless there's any cure for HIV, there's always going to be support needed for people with HIV, and that we now have a generation of people who've grown old with HIV, and particularly for those diagnosed before 1996, before effective treatment, they have worse health outcomes than others. And so we need to make sure that those issues around comorbidities are understood, and that real support is provided to them. Many people grown old with HIV, that particularly again those who thought they had a very short life expectancy, are dealing with isolation and poverty. Many cashed in their pension because they were told they weren't going to be alive for much longer, and the impact of that is now being seen. We're having to provide more advice than ever around how people try and chart the benefit system. I had an email from someone today whose universal credit, he had to fight with help from Terrence Higgins Trust to get an uplift in his universal credit, and he was being underpaid by 35% since the beginning of last year. And again, that when somebody who has also had a cancer diagnosis as well as HIV, to have to try and fight that constantly was really, really difficult for him, and we were very pleased that we could help with that. So I think that's all going to be there. Let's not forget though, there are significant levels of sexually transmitted infection still. We've got the highest rates of syphilis since the Second World War. And so it's really important that we don't forget the other sexually transmitted infections as well. And as a HIV and sexual health charity, for us, it's about making sure we put the same level of focus around HIV that we to other sexually transmitted infections as well. Just on the international point, we cannot ignore the fact that, yes, it'd be great in England and the UK to end new HIV transmissions. Let's not kid ourselves that unless there's that continued focus on the international position, then actually that's not going to be sustained for longer with international travel, etc. And so that's why a global effort is needed. The 2030 target is a global target set by UNAIDS, and it's a shame, isn't it, that the funding for international development has been cut so drastically, and a lot of that funding does go into HIV prevention. That's something that needs to be addressed.
Could I do a quick couple there, Tom? I was just going to add to a what next with perhaps a what else, mainly to cover the fact that I missed it when I was supposed to say it at the beginning. That around the COVID vaccine, at the moment, if you've got a positive HIV diagnosis, then you are category 6, but it requires you having registered this with your GP, so that because the letters and whatnot come through them. We're pushing the government for a solution around that. You know, I think an elegant one would be to do it through HIV clinics if that's where your treatment is being accessed, but we're open-minded. But in general, we think that needs a solution that doesn't mean that you miss out. So that's kind of a what else. I think what's next, and you know, it's a concurrent thing too, is that, you know, to carry on where I started, it's about trans rights. That's the one in our generation. That's the really hard thing. That's the one where, as Wes says, even within our movement, that remains an ongoing struggle. So that to me is what else and what next. And then on the development point, I know Stephen's wrapping up, and you know, Stephen's one of the leading voices in our party around international development. But it is, as Ian says, a shame around the 0.7%, and we must keep the torch burning for that. You know, we're at a point of, you know, what's Britain's place in the world, and there's some negative connotations to that, but there's also some positive ones. And you know, sometimes you turn on Twitter and see people arguing about the British flag, and then you turn it off straight away again. But if you want something to be really proud about our country, you want to know something really special and different about our country, it's over, you know, the past however many decades, the numbers of lives saved around the world through our commitment to vaccination programs globally, through our commitment to running water, through our commitment for education for girls and women as well as men and boys. Those are things to be really proud of, and this exactly sits in that. You know, we have a responsibility as a developed nation to be a beacon, to do this first, and that hopefully pulls up those around us, but then to support others to do it as well. And again, UK aid is the best way to do that, and we've got to keep that light on and restore at the first possible opportunity.
Fantastic, thank you. And then I guess we've had a lot of questions about PrEP and PEP in the chat. So one of the questions is around how do we increase awareness of education about PrEP and access to it. I think, you know, amongst the sort of gay male community or gay and bisexual male community in big cities like London, it's very well known, but amongst other communities in London and those living perhaps more rurally, it's not as well known. So how do we increase the education there? And how do we increase access and knowledge about PEP for those who might have been exposed to HIV? I might come to Steve and then Florence on this one.
Yeah, so I think it's a really good question. It is something that I think we all have a responsibility to talk about. I think the NHS has a responsibility to talk about it, in all fairness. I think again, it's really hard to sort of what's the one answer. I don't think there is one answer. I think there's a stream of answers. GPs, I think any interaction, what we need to get to a stage of is where any interaction with a health professional, something like or the NHS more broadly, you have the opportunity to learn this information. So PrEP and PEP are really important. The PEP element is equally really important, and I myself have made sort of friends and sexual partners in the past aware that, you know what, if you are worried, that absolutely you need to have that. Go and get it. It's available. I think we all need to sort of just continue the conversation and continue the conversation about what is there, because there's something about just normalizing the conversation for me, and PrEP and PEP really help that sort of discussion. It softens it, makes it less scary, actually, as a process. Especially, I mean, I remember going on several dates in the past, and at what point do you tell someone that you've got HIV on a date? It's a really, really difficult one to, you do it on your first date, you do it on the second. And there are so many people out there that don't know that, one, if you're on medication, you can't pass it on, but equally PrEP is there to help protect you. So I think I take an element of responsibility to help people on that journey, but equally we need to just increase the profile of these treatments or preventative treatments so that people can see that they're available.
Yeah, just to add on to that as well, it's around obviously the campaign around accessibility. But what I'm worried about is that we don't then see PrEP becoming a postcode lottery, depending on where you live. So we've got to be really careful. Obviously, you know, representing an inner London constituency, I know that my constituents who need that medication will have better access. You know, to the points that Alex mentioned, you know, we've got to think about people in rural England, people right across the UK. So it's so important that we don't see a postcode lottery with that medication available, which unfortunately we've seen with other treatments that have come on the NHS. So it's fantastic for the work that the campaigners have done in terms of making sure it's available on the NHS. But I think the next step is making sure it's rolled out right across the country for people who need it. I think the other thing as well is around the fact that it's difficult now where we're in the lockdown and pandemic. I had a case highlighted to me by a constituent where this wasn't about PrEP, but just about access to medication. And during the first lockdown, they could call their GP and be prescribed with their medication prescription over the phone. Now, this third lockdown, the GP surgery was insisting that they had to come in. And, you know, this resident was shielding, they were disabled. So again, you know, we need to look at how people are able to access that via their GP surgery. Do we need to take it out of the GP, make it sure it's available in more community settings? You know, all those things need to be worked out.
Tom, can I just quickly come in there? Just I think just to say that on PrEP in particular, the government has not yet confirmed funding for next year in relation to PrEP. That's something is the absolute priority, and we've had to fight so hard to get them to put funding in place for this current year. And the other point, which is linked to Florence's point as well, and this is about access. Currently, the only place you can get access to PrEP is in a sexual health service, in a sexual health clinic. It should be available more widely, and as it's available more widely, that's when you're going to get greater take-up. I mean, there'll be people who would never darken the doors of a sexual health clinic who actually really could benefit from PrEP, and a lot of those will not be gay men. And so I think it's really important that it's included within the GP contract as well, so PrEP doesn't become anything that's special. We want to see PrEP as another preventative drug that works for the vast majority of people all the time. And I think it's so important that it's available and accessible.
Brilliant, thanks, Ian. And I can come straight back to you, perhaps with two more questions about research. So one question we've had in is about the prospects for an HIV vaccine. And the other is from a member of the audience who says that the increase of access to PrEP is a huge step forward in the fight against HIV. However, I'm aware it doesn't work in exactly the same way for vaginal sex. And so what prospects are there for research to provide protections for everyone against HIV?
Yeah, so on the latter point, first of all, actually, I think there's very limited research to sort of say that vaginal sex is the protection is less in HIV. There's been some research, but I think we can say quite clearly that PrEP, when taken properly, is almost 100% effective, and so for men and for women. So I think that's really important we get that across. But always we need to make sure that we are have a very strong research base to make sure that people feel entirely comfortable and confident about that. And in terms of vaccine, I mean, HIV is a really, really difficult virus because of one of the key things about it is it attacks the immune response. And so to actually, and antiretrovirals are great because what they do is they sort of interfere with that immune response to make sure the virus is then put to undetectable levels, but you need at least 2 drugs to do that, normally 3 drugs to facilitate that. So the prize is a vaccine for HIV. I think that's some way off, but that shouldn't be a barrier to preventing new HIV transmissions, because we have the tools available to us now to end new HIV transmissions, and so a vaccine isn't necessary, but it'd be great if a vaccine could happen. I think there has been a concerted effort over a number of years, but I think we're still some way off achieving that.
Great, so we've got time, I'm afraid, for just one more question before we have our closing remarks. So I'll come to everyone on this one, and it's how do we use It's a Sin to make sure that those newly engaging with HIV engage with it as it is rather than as it was. So perhaps if we go Steve, Florence, Ian, and then Alex.
Thanks, Tom. Yeah, so as I said at the beginning, It's a Sin has really sparked a conversation that I don't think I've ever seen at the level of which I've never seen in my lifetime. And you know what, that's a massive opportunity. And it set a picture, didn't it, about a state in the 80s and early 90s about what it was like. What I think we need to do now is take people on a journey to what it is now. Actually, it's not a death sentence at all. You can live, Ian, you're living proof, I'm living proof that you can live absolutely fine with HIV now. I think we need to take people on that journey, and the work that Terrence Higgins Trust does to do that, and has done recently is really important. We can't lose this momentum though. We absolutely need to bring people along that journey, continue the great work that we're all doing to have this conversation in schools, in Parliament, on an international level, and we will get to, I'm confident that we will get to where we've been, because I think Ian reflected, who would have thought that we would be where we are now when we were in the 80s? And I think that is living proof that we can get to where we want to be. And you know what, we've been given a massive boost again with It's a Sin. Let's just keep that momentum going.
Yeah, no, definitely. I think it's seeing people then being able to talk about that in a more free way. But equally, we should be mindful that for some people from some communities, they still have to hide. They're still not open about their sexuality. So we mustn't lose sight of making sure we continue to advocate and fight for those people. And, you know, there are still people facing a number of persecutions, people still being killed, people who are fleeing and seeking safe refuge here in terms of asylum. You know, on an international front, that's what we can be doing, making sure our immigration policies are helping people who genuinely need help. But I think that the thing for me is around the fact that we've got a news cycle, 24-hour media. So using It's a Sin and you know, getting that conversation going. Like I said, a number of young people are more advanced than we would ever think now because of the tools on their fingertips, but it's making sure they're learning the right things in a safe way about safe relationships, safe sex, and you know, normalizing that conversation a lot more. Alex talked about the fact that, you know, thinking about his time at school, I think about my time at school as well. I went to a Roman Catholic primary school, secondary school, sixth form college. And again, it's almost a case of the girls were sort of shunted away and spoken to about sexual relationship in periods. But yet, you know, now we've got to make sure it's not just girls being spoken to, it's boys, it's everybody. We need to normalize that. And I think it starts with education.
Yeah, so I mean, It's a Sin has meant we've been incredibly busy, which has been a fantastic thing. And there is now a national narrative around HIV, which we've been fighting to have for many, many years. And so it is a once in a lifetime opportunity to harness that. I think Steve's point was so important that It's a Sin is demonstrating what HIV was like in the 1980s. We need to now make sure that people journey to 2021 and have up-to-date relevant information about HIV today. And we're working with a number of different organisations, including Channel 4, to make sure that that happens. But also, you've probably seen from our social media posts and also the press activity that whenever we can, we need to get that message out there. But it's a shared responsibility that all of us have, not just HIV and sexual health charities. You know, parliamentarians have a really important role to play in that, as do other civil society leaders. as do commercial organisations, as do those of us who are engaged in local community organisations. Let's keep the narrative going, and let's try to make sure that HIV is something that we don't need special permission from a television programme to talk about. It should be something that we're talking about constantly, because actually it's a bloody good news story.
Yeah, I mean, I'd reiterate everything that everybody else has said. So in the absence of doing that, thinking of what we might add to it is to make sure we're having the conversations with our friends in our networks, using our platforms, that it's not just about LGBT plus men and women. The story was about how badly they were treated on the way for us to be where we are today. And we're in a much better position, both culturally and scientifically, to engage with the issue. But what you can't take from that is, well, it's something that happens to LGBT plus men and women, because actually the reality is we know that, and certainly as we make inroads in those sections, it may well be that it becomes a greater proportion where that's not the case, you know. So we have a responsibility to make sure that isn't the message that people are taking away from that. So that's kind of what I'd add to it.
Brilliant. Well, thank you so much. I think that was really instructive. So that's it for questions. I'm really sorry for the many that we didn't get to. We tried to get through as many as possible, but we are delighted to now be joined for closing remarks by Stephen Doughty, the Shadow Foreign Affairs and International Development Minister and the chair of the All-Party Parliamentary Group on HIV and AIDS, and of course, one of our patrons. Stephen.
Thanks very much, Tom, and I hope everybody can hear me okay. Firstly, I just want to say a huge thanks to LGBT Labour for putting this event on, and all the panellists today, really powerful contributions. And as well as being proud to be a patron of LGBT Labour, as has been said, I'm also chair of the All-Party Group in Parliament. It's one of the oldest groups in Parliament, and with some very powerful supporters in the Commons and the Lords, many Labour, of course, and the group has fought for change on HIV for decades, domestically and internationally. And just some of the examples of our recent work, we've done a recent report around COVID-19 and HIV on the impact of fragmentation in England from the Health and Social Care Act, mental health, crucial issue that has not been talked about enough in relation to HIV, PrEP, and of course we've also campaigned internationally, and one of our proudest successes recently was in securing new UK aid for those working with the most marginalised communities globally, including sex workers, trans community, minority groups, and achieving that at the last International AIDS Conference held in person in Amsterdam, working with Stop AIDS. Just reflecting on what the panel have said, firstly, agree with everything that Wes said and really commend the work of the HIV Commission, absolutely fantastic, and particularly his comments regarding trans and non-binary communities. And we as an all-party group are shortly going to be holding a specific event to discuss the impact of HIV in those communities. I want to thank Alex personally for his commitment and engagement and interest as a shadow minister. Been absolutely fantastic to work with, and his assurances of what a Labour UK government would do is absolutely critical. And I know that John Ashworth, Keir, Angela right behind that, and John spoke about HIV in Parliament this week. Steve, you know, absolutely powerful lived experience, and that crucial message about you equals you. You can't pass it on if you're undetectable and on treatment. And one of the most crucial things we all need to do is listen to those actually living with HIV and to recognise the different faces of HIV. Two of the most powerful meetings I've been to in the last few years were listening to a 13-year-old girl working with Cllr, telling me why did she have to access HIV services through sexual health services, which she didn't feel were appropriate for her. And also listening to a 55-year-old heterosexual woman diagnosed late and the impact that her HIV diagnosis had had on her. Flo, incredibly powerful about the impact and challenges of HIV in diverse communities. It's a powerful message we've taken on board as an all-party group, and it's, I think, a message that the HIV sector as a whole need to hear much more loudly. And Ian, of course, always proud to work with Ian and partner with THT. Optimism about the end in sight and an end to new transmissions. We totally agree on that, but raising some of those critical challenges such as the cuts to public health funding and challenges at local authority levels in England. But, you know, I agree, we can do it. We know what we need to do. We've all got to get together and do that. And in that vein, I've got my testing week hoodie on. Just want to say that we're going to be launching a new inquiry for the all-party group on testing, particularly. It might seem strange to say it's an LGBT event, but we've got to fight for more action in the straight community, amongst others. The data released by THT shows that the uptake of testing is far lower in heterosexual people. Of course, almost 4 in 5 adults have never been tested for HIV, and 4 in 10 people diagnosed with HIV diagnosed late, and every late diagnosis is a story of a missed opportunity to test, and we have to get to grapple with that. We're also going to be doing an additional inquiry this year on HIV and BME communities, and I think that's absolutely critical, because I don't think enough is being heard and understood about the impact of HIV in those communities and some of the particular challenges that Flo spoke about. But we've also heard obviously a lot about England today, but of course HIV knows no borders, just like COVID. And my first encounters with HIV face up were in Africa, in Malawi, in the early 2000s, traveling through villages where branches are put on the ground. You're driving past, I was asking, why are these branches on the ground? And they said, that's because a funeral's happening. And you were going through village after village after village after village because of the sheer number of people who were losing their lives. And the reality is that we still saw 1.7 million people newly infected globally in 2019 with HIV, and 700,000 people died from AIDS-related causes, despite all that incredible progress that we've seen in treatments, in diagnostics, in testing, and so on. And unless we invest in public health, in diagnostics, in testing, in treatments, we're talking about vaginal HIV a minute ago. IPM just brought out their new vaginal ring, which is going to be critical. Vaccines, the incredible work being done through IAVI, and of course education, not least given the stigma surrounding HIV in this country and globally. If we don't invest in all of that globally, we won't meet that 2030 target. And unfortunately, with the impact of COVID-19 already, the UN Global Fund fears a huge slide back in progress in tackling HIV globally. And of course, the abolition of DFID, cutting the 0.7% target, literally will cost lives. And we've got to fight on our hands about this. And it's in Labour DNA to fight on these things and to recognise this is a global challenge. We've got to stand up for it in our own movement, as well as taking on the government on the cuts they've done. But lastly, one of the most powerful things I found in It's a Sin is the stories it tells about Wales, about Scotland, about the British Nigerian community, and about parts of England outside London. Of course, the Isle of Wight features heavily. And in Wales, I'm really proud that the Welsh Labour government has been leading the way on HIV. Vaughan Geffin, our health minister, my constituency colleague, announced a commitment in Wales to ending new HIV transmissions in 2018, first government in the UK to do so. And that government has also shown resolute public support, not only for the LGBT plus community, but also explicitly for trans and non-binary people too. Wales has led England in access to PrEP, where Wales didn't have a CAP trial and announced earlier in 2020 it would be routinely available on the NHS in Wales to anyone who felt they were at risk of HIV. Cardiff, my own city, has officially become a fast-track city, and HIV cases have dropped 15% in Wales since 2018. But there are some big challenges. For women, new cases going up, and late diagnosis is higher in Wales than in other parts of the UK, so we recognise what we need to do. Scotland was one of the first countries in the world actually to launch a publicly funded PrEP programme, and Edinburgh, Dundee, Aberdeen, Glasgow also becoming fast-track cities. But sexual health and bloodborne virus services have been affected by significant reductions in budgets year on year in Scotland. And unfortunately, since 2015, there's been a specific outbreak of HIV amongst people who inject drugs in Glasgow and the Clyde area, with over 145 new diagnoses in that group. Northern Ireland, we've seen some really positive progress, a decline of 49% from a peak of new HIV diagnoses in 2015. And lastly, we heard a lot tonight, rightly so, about some of the particular challenges in particular communities. Of the 1,500 or so heterosexual people diagnosed with HIV in 2019, 37% of those were Black African men and women. And of the over 4,000 new diagnoses in 2019, 45% were among people from BME Black backgrounds. Among gay and bisexual men, new diagnoses have significantly come down, but diagnoses in women have declined by a much, much lower level. And women accounted for 28% of new diagnoses in 2019. And we've also heard about young people, and I'll end on this point. There is still so much lack of awareness, so many myths. I recall being on a panel, I think it was with you, Ian, just a few years ago at the LGBT Leaders Conference, and a young gay man got up in the audience and said, effectively, you all need to stop being so promiscuous, and anyway, I can't get HIV because I'm a top. You know, there is so much myth, so much nonsense out there, and we've all got a role to play in raising awareness about HIV, raising awareness of what's changed, raising awareness of testing, and of course ensuring that sex and relationships education is across our country, across the United Kingdom, and is inclusive, and that HIV and sexual health is a crucial part of that, as well as, of course, the LGBT plus equality that we all fight for as a movement. But thank you so much for the event today. Thank you to an amazing panel, and you know, we will work as an all-party group with LGBT Labour, with THT, and all of you to help make this this fight, you know, achieve its absolutely critical goal of ending new infections of HIV.
Brilliant. Well, thank you so much, Stephen, for those stirring closing remarks and for reminding us what Labour can do in power and has done in Wales. And thank you to all of our panellists for what I think has been a really interesting and ultimately hopeful discussion. I think after the trauma of watching It's a Sin, it's wonderful to be in a place where we're talking about ending the transmission of HIV for good and knowing that the reality of living with it is very different today. On the topic of that show, Councillor Philip Normal, one of our members, has designed a t-shirt that takes the iconic phrase from the show, so you can get yours from his shop, and you'll be donating £20 to the Terrence Higgins Trust in the process. He's raised, or at least this morning, it was almost £100,000, so it could well be more than that so far. So if you just search Philip Normal you can get one. You can also join LGBT Labour on our website as a full member, a student or unwaged member, or an ally, and buy our beautiful t-shirts, tote bags and mugs, all of the proceeds of which help us to run the organisation and will provide vital funding for LGBT+ candidates in the upcoming Scottish and Welsh parliamentary elections. So that's it for our first event of LGBT+ History Month, but I hope you'll be able to join us for the rest of our events, which cover issues ranging from surrogacy to trans political education, and they're advertised on our Facebook page and on our website. So thank you very much again to our panel and speakers, and thank you for joining us.